Some 120 internally displaced persons at the Makepe Misoke neighborhood in Douala, in the littoral region, have been offered free medical consultation, screening and medications from Salvation Medi-Rescue Mission for Africa, ESMA and partners.
Salvation Medi-Rescue is getting straight to the downtrodden, the underprivileged here. We decided to sacrifice. Today is not a working day, to come and actually give them a moral booster to the particular humanitarian gesture they are carrying out. And it's not only actually going to end today.
The ever-present Dr. Simon Pichilano and team put a big smile on the faces of these Cameroonians from the two English-speaking regions of the country, plagued with upheavals for close to 4 years now.
I'm excited that we came. We are all witness to the fact that there were so many that needed our attention. We had to close, we had to stop more people coming for consultation, for free consultations and treatment. I am excited with the fact that we saw cases that we will have to take out of this place, because there are cases that we couldn't even treat here. Take out of this place. Since we're working with Presbyterian Health Services, we're in partnership with Africure and other organizations. I really feel that these ones we saw who could not help themselves, like the patient who has been staying for over a month, who needed attention and had no money. I can boast that by the end of the week, that patient will be treated. By tomorrow, we'll be arranging for that patient to be treated.
Convicted with the fact that health is wealth, which also ties in with one of ESMA's objectives of providing medical assistance to the poorest communities in Africa, there was no age barrier during the February 2020 screening. From the youngest to the oldest, both the doctors and the nurses alongside the lab technicians took turns to consult and diagnose these downtrodden from fever, malaria, hepatitis B, diabetes, typhoid, and the list is long.
Minor cases of malaria, typhoid, tinea capitis, tinea corporis, all those conditions that are characteristic of an environment like this where you have so many people, diarrhea and so on. Those ones, we've taken care of them.
A humanitarian assistant, this lady with 8 children from Minchum Division in the Northwest region, who have been taking refuge here in Douala for the past 2 years, greatly appreciated.
The doctor today, I thank you very much, because
I want to thank Dr. So very much for the free consultation and medications given to us. I and my 8 children have been tested negative. We have been asked to come back here and collect those medicines which are not available now.
Meanwhile, this other man from the Southwest region who was shot on the arm during the crisis applauded the largesse of ESMA and partners, and at the same time called on government to fine-tune better strategies to put an end to the crisis, for them to retire to their respective regions because the sufferings away from home is enormous.
From Southwest Province region, of course. Then I was shot by the military. Those people mistakenly shot me on my right arm, as you can see like this. The iron was first here. They removed the iron before they put this thing like this. That was on that was roughly on the 18th of October that this thing happened.
18th
so,
of October of which year?
Of 2019. Okay. So they brought me here as they discovered that they mistakenly shot me, that I am not one of those boys. They carried me and brought me here to this hospital general. They treated me and then abandoned me halfway. They abandoned me halfway. So for now, I'm here helpless. You see, I've gone to the hospital. I have all the documents that the doctor at hospital general, they prescribe it, they write how this thing, how they worked. They send me outside. So before they discharged me, the hand was not able. The gun took me here and broke my bone. They broke it here and broke it here again. I have the radio, all the document, I have it. So as they abandoned me there, I heard that there's a place here where they used to help these internal displaced people. So that is what has brought me here. Where I'm pleading that it is good, they are seeing the way we are suffering in TV. Most of us are suffering, we are innocent, we are not even concerned about this. We want that this situation, they should arrange it so that we go back to our own places and see what we can do. We are pleading that they should stop this problem, the first thing. Then the internal displaced, as you can see me like that, there are so many people in the bush that are suffering. They don't have way to even come in town. And they cannot, in fact, I just plead that they should beg the government that they should end this thing. That is first. Then there are so many people that they cannot even, as you have seen me today, if not because I have a friend here, I could not have been here because nowhere to stay. So, first of all, I thank for the medication they have given me and this test. I was afraid I may be, but since I'm free, I thank the organization.
Chief Dr. Mufo Joseph, who has been providing shelter to these displaced persons for all these years, appreciated all men of goodwill, both collectively and individually, for standing by these deprived Cameroonians in times of need. However, his one wish was that ESMA should provide more screenings because these IDPs keep flooding his palace with the persistent nature of the crisis. He has also lambasted imposters who are taking advantage of the current situation to amass wealth for themselves.
For the ESMA Foundation, they are really doing a good job. As hurt is concerned, there is nothing richer than hurt. If they give you nothing, but they give you hurt, it means the person is really conscious and he has a good consent of your person. What I will make ESMA Foundation to understand is that these children, as times comes and go, they come in all these two regions and they come in every day's basis. You will consult this today, maybe in a space of a week or 2 weeks, there will be new other children. I believe fine if this foundation has taken this responsibility to do this marvelous job. I believe it will be continuously to receive the new ones that they will be coming in and this palace will be registering them.
Dr. Simon P. Chilano has, however, given a clarion call that all hands should be on deck to give these persons a meaningful life.
CMF Bonamusadi, who have is a congregation that has made name in humanitarian, humanitarian gestures. So we have already raised over $1 million just in 2 sessions for IDPs in Douala and environs. So we are calling on other congregations, not just Presbyterian Church, Catholic Church, Baptist Church, or Protestants. We should come together. The IDPs are not many. They are not many. We are more. So if the will is there, I believe that at the end of the day, no IDP will die because she never had food to eat or never had the means to get treatment.
The over 9 hours consultation and screening exercise by ESMA on Sunday, February 23, 2020 is not yet over because severe and complicated cases will be referred to specific and specialized centers for proper treatment and follow-up, which other better assistance could be given to humanity aside good health,